It is important that everyone is well informed. And when you're well informed, you can make your best decision. And there's no reason from anybody to hold back any information. This is a safe vaccine that has been tested in the same way that we have tested all vaccines. The only thing that is missing is that we don't have years and years of experience with it, but the development of the vaccine was just as strict as any other vaccine we ever had. I have had no contacts with anyone that has had any significant problems with the vaccine, and scientifically speaking, there should not be any unusual problems. And we have heard people say that there's a microchip in it. There's absolutely nothing of that sort. It's a liquid, and we cannot put microchips in liquids. And so this is not a plot to try to monitor people. This is not a plot to control people. It's strictly something that is good for your health and the health of the entire nation. I've received both doses of the Pfizer vaccine. I had no issues with it. I didn't even know that I had it. My family, my wife had it, the vaccine with absolutely no issues, and all the staff in my office has had the vaccine, and we have had no reactions. I know of no reasons to avoid the vaccine unless you are known to be allergic to one of the components. Now, it is true that there are some people that overreact to vaccines, so if you have had a severe vaccine reaction, discuss it with your doctors. There are things that we can do to minimize the risk of you having a severe allergic reaction. Just remember, this is not just about your own health, it is the health of the community, and that includes your family, and any family member or community members that may be at risk for complication of the disease. This is a disease that kills people. This is a disease that's especially bad for the elderly people and for people who have other diseases such as diabetes and even people who are obese. And so it is not just about you, but it is about keeping your family, your friends, and the community healthy.
You do not catch COVID-19 from getting a COVID-19 vaccination. What it is how I describe it to a lot of people. It's, I'm a former educator, right? So I think about it as a pre-test and a post-test, right? So when you see a pre-test, you kind of don't really know what to expect. You're just kind of looking around at the questions. But then after you get a little bit of learning and education, the next time that post-test comes around, you're going to be ready to go and know how to answer. And that's what your body is doing. So the first injection, if you get a 2-dose series, is just kind of like your body just kind of figuring out what to do. And then with the second vaccination, your body's like, okay, we know what to do. We're going to respond. So it's just your body responding in anticipation of an actual COVID-19 infection. I think one of the key factors in deciding whether or not you get the vaccine is, if you have a primary care physician, is to establish a good rapport with them and have an open and honest conversation. But really, there are hardly any reasons. Majority of people who are immunocompromised, who have cancer, who have diabetes, a lot of conditions can still get the vaccine. Transparency is extremely important on all of our parts. And I think one of the key factors in transparency is, while you may receive information from your employer or you might attend a town hall, it's very important to do research on your own and make sure that you look at reputable sources. For instance, the CDC, listen to reputable newscasts like NPR, go to your local health department website and do your own research, so therefore you can verify this information that is being told to you via your employer or town halls or any other method that you might come across vaccine information.
For me personally, I was really motivated to get the vaccine because since the beginning of COVID, we've heard that, one of the most impacted areas have been long-term care facilities. So I felt that with being a frontline worker that I was more exposed and more at risk for, coming into contact with COVID and not only taking it home to my loved ones, but potentially being someone that would bring it here, and I didn't want to be responsible for that.
Well, my husband got the virus, and that was part of the cause of his death. And that was, so for that reason, I think it's important.
It was important for me to get the COVID vaccine, to do my part, and to help stop this pandemic so that our residents can get back to normal lives, not being isolated or having to stay 6 foot apart from people.
Well, the pandemic had put a scare into me, and I was uncomfortable with socializing, getting out, and of course the 4 walls were closing in. So I wanted to get it so that I could get some relief from that. And I just felt it was the right thing to do, especially here in the Culpeper.
I think a lot of it is just fear of the unknown. I think certainly it's an adequate statement to say there is some unknown, but we've all done well taking it. Their co-workers and everybody's still healthy and now vaccinated, so I think that's an encouragement.
Everything was so smooth. The gentleman that gave him the shot was open and willing to answer any questions that I had, but I did my research prior to sitting in the seat so I wouldn't be nervous. But everything went really great.
Oh, it was nothing. It was almost like, I guess you could compare it to a flu shot. After the first one, my arm was a tiny bit sore. I had no other symptoms. And after the second one, my arm wasn't even sore.
It certainly is no big deal. It's seamless. Neither my wife or I had any reactions to this. My daughter-in-law and my sons that have had this certainly had no reaction, and they, just as I, say it really gives you a margin of comfort which you can intermingle with those with whom you come in contact with.
The first time, the first injection, I was very sleepy, and I slept, and I thought, well, I'll never sleep tonight, but I did. And the next injection, I found out I lost some of my appetite. They all said that went with it after the fact, and that suited me fine too.
The biggest benefits, in my opinion, is the fact that we work in this industry. Not only do we protect ourselves of potentially getting very sick, possibly dying, but we're also protecting our families, we're protecting our co-workers, we're protecting the residents that we are here to provide services and care for the rest of their lives. And if we're not healthy, well, how can we take care of our resident? I think it's an obligation as a healthcare employee, team member, to do our part, to get vaccinated, to protect ourselves, but protect our residents. That's the most important thing, in my opinion.
This is about the group. And whether you are a staff member, a resident, a patient, we're all one team together. And we have to work together against this virus and the spread of this virus.